Hello, everyone, and welcome to Compassionate Conversations. I'm Tanys Coughlan from My Place Home Care, and I am joined by my beautiful co-host, Heidi Gagne.
Hello.
And we have an awesome guest today, Dr.
Hey.
Ellen Simone. Welcome.
Yes, thanks for having me, Tanys and Heidi. I'm excited to be here and to share my knowledge with you guys.
Very
Super
excited
honored.
for your knowledge.
Yeah, exactly. So why don't you tell our audience a little bit about you and sort of how you got into doing what you're doing?
For sure. So I'm Ellen. I'm a naturopathic doctor, and I own the clinic Bright Moon Wellness in Ottawa. So I guess I had never heard of naturopathic medicine growing up, or even what a naturopathic doctor was. And then one day, my father, who was doing courier work, delivered something to the Canadian College of Naturopathic Medicine. So he came home with this brochure, and he was like, "Ellen, I think this is what you should do with your life." And I was like, yeah, Dad, whatever. I don't know anything about this. I'm not going to listen to you because I'm 19.
Yeah.
But I did read the brochure, and I was very intrigued. And so I chose to do a Bachelor of Physical Health and Education as my undergrad at the University of Toronto. And basically, it was all about exercise and nutrition and mental health and focusing on prevention when it comes to healthcare outcomes. And so I was really interested in that. And then that sort of led me to become a naturopathic doctor, because really the principles of naturopathic medicine is really what drew me to the profession. So it's a lot of like doctor as a teacher. So I'm here to educate my patients and empower them and help them make healthy lifestyle choices and advocate for their healthcare and navigate the healthcare system. And then it's also very holistic. So exercise, nutrition, mental health, all of that really is the foundation for optimal health. So my undergrad kind of led me nicely into that. And then the great thing I really love about it is like the flexibility and creativity, because we treat you as an individual and we have many different modalities that we use. So in addition to nutrition, exercise, sleep habits, stress management, I can also use homeopathy or traditional Chinese medicine and acupuncture, as well as botanical medicine. So I have all of these different approaches for looking at your health. So it was very interesting to me, in like that connection with nature and trusting your body's intuitive ability to heal itself and support it. So yes, hopefully that answers your question.
Yeah. And I know one thing that stuck out for me when we first met was, we've known each other a while, was the fact that, you've got the same, if not more, education than a medical doctor.
Oh, yes. It's very similar, but yet different.
Yeah.
And so in order to become a naturopathic doctor, you do need a university degree, and you do have to do science prerequisites. So I had to do, the biology, the chemistry, the psychology, the biochemistry, which, I did pass. I got in, but it was not enjoyable at all.
Yeah.
Right.
But you do need to have that biochemical foundation of things and knowledge. And then there's a private college in Toronto called the Canadian College of Naturopathic Medicine. So that's a 4-year program. It's similar to the chiropractic college. We're actually down the street from each other. So you go there, and that's where you learn similar things to traditional medical school. So I have to learn anatomy, physiology, pharmacology, because a lot of my clients come in on lots of pharmaceuticals. So I need to be aware of, I want to give you this herb, but is it going to have a negative interaction with the pharmaceuticals that you require? So the foundation is very similar, but then in addition to the pharmacology, because I don't apply the pharmacology, I cannot prescribe any pharmaceuticals. Instead, I use all those natural tools, so different nutritional diets or dietary changes, nutritional supplements like high-dose vitamin D or omega-3s or turmeric as an example. And then I have the whole system of Chinese medicine, homeopathy, and then all the herbs. So that's where the other training comes in. And then we do obviously practical training. I think I did, at least 1,500 hours of patient care under supervisors. And then there are license exams. So I'm licensed to practice in all of North America, and then a board exam for Ontario. So we are a regulated health profession, just like family doctors and physiotherapists and chiropractors.
Okay. That was going to be one of my first questions, is what makes a naturopathic doctor a naturopathic doctor? Because it's when you think doctor, you think PhD, you think medical school, you think all these things. But I was looking on your website, which is beautiful, by the way. I love
thank
your
you
website.
so much.
Yeah.
Just so calm and serene and informative. And I love the phase idea, the phases of phase 1, 2, and 3 of your healing. I think it's beautiful. And I totally forgot where I was going with this.
I guess, did you want to know about like the regulatory process or like how
it wasn't more
I
of the regulatory,
myself or call myself a doctor?
Yeah, well, that would be, I mean, is that, how did you become the designation of doctor then?
Yep. So you have to graduate from a naturopathic college. And then, yes, there are North American license exams, which you're required to pass. And then depending on which state or province that you work in, there's regulations that you have. So you have to do more exams to pass.
Okay.
So there's the the Ontario College of Naturopaths. So they regulate our profession. So we're under the RHPA, which is the Regulated Health Professions Act. So it's the same legislation that oversees medical doctors, psychotherapists, massage therapists, naturopathic doctors. So we are entitled to use the doctor title as long as we say naturopathic doctor after, to sort of clarify what type of doctor we are. And what makes us unique, or I think why we have that ability to do that, is we are trained in primary care. So I am trained to think like a family doctor. So when a client comes to see me, I do a whole health history assessment. I can do physical exams. I can even do a gynecological exam. So I have those rights. I can draw your blood, send you for blood work. So I operate similarly to a family doctor, and I also have similar scope of practice to a family doctor. And so I guess where our training is to think like a family doctor, because what if somebody comes to see me and they don't have a family doctor? So then I can say, oh, well, you're telling me you have these red flag, very serious symptoms, which need more attention. And then I would refer them back to a family doctor or a walk-in clinic and help them navigate the care that they need. Because I am unable to do ultrasounds or scans, I also cannot refer to a specialist or prescribe pharmaceuticals. But we're actually like an asset to the healthcare system when people don't have family doctors. So we might be the first one that they see, that they say, oh, I've been pooping some blood. Is that normal? It's like, no.
No, never. That's always a no.
That's always no.
Go see somebody. Yeah. So we sort of offer, this care to that catchment of society that, maybe you moved here and you don't have a family doctor.
Right.
So I hope that answers your question. Yeah.
And I think it's important to know that you complement the medical. Like it's like another medical.
It's another
option,
level,
right?
Another part.
It's another part.
It is.
Yeah. It doesn't have to be. I think there may be a misconception that if you're going to a naturopath, that you don't go to your doctor. Or
no, you still need your family doctor.
So you don't need a naturopath, and they complement each other so well.
Yep, I find the area where we work the best is, like, I always encourage people to go back to their doctor, request testing, request referrals, request imaging. It's like, you need to do your due diligence to make sure everything bad and horrible and major is ruled out. And so all your tests are normal, all your scans, all your scopes are normal. That's excellent. Like, you've done that. I made sure you did that. And then you're like, oh, I'm normal, but I don't feel optimal at all. There's still more functional things going on. Maybe your stress is getting to you. You need more sleep support. We can improve your nutrition. So that's sort of my favorite client to work with, is the one that's normal on all the testing, but they don't feel well still. So because there's so many other options that are out there.
Mm-hmm.
That's amazing. So we had talked earlier that there was so the main discussion we'd like to have today is on pain management, as it is Pain Awareness Month. But we're kind of looking at more of a natural, maybe less medicated, and more other options. What can we do to deter pain in general? And for those that might not want to take medication, what other options do they have? But So one quick question I have before we get into some of that stuff is, if you can't prescribe pharmaceuticals, where do people get the herbal remedies, and do you need a prescription or a sign off on these things?
So for the majority of the herbal remedies and nutritional supplements, you don't need a doctor to sign off or a prescription from me. A lot of things you can just go to the health food store and purchase. So a lot of people come to me with their bag of supplements and they're like, yeah, you know, Google said this and ChatGPT told me to take this and my friend told me to take this, but I don't know what to do. So often, you know, lots of things are readily available. I think the goal of seeing a naturopathic doctor is to get guidance on what is right for you as an individual, as well as a lot of the things sold at the general health food store or, you know, online they're good. They're safe for the general public. So this formula for pain management, let's say, might have the right things in it. It might have turmeric or glucosamine or boswellia, like all these herbs that are anti-inflammatory at a very low dose, let's say 50 milligrams. So that would be safe for anyone to just go by and use and maybe have some effects for lowering their inflammation and their pain. But if you came to see me with a specific health condition, I might recommend 500 milligrams instead of 50. So I guess I have the knowledge to guide people to safely use herbs and nutritional supplements, but at like higher therapeutic dosages that might be more effective or individualized for them. So then I would say, okay, well, maybe you choose this formula instead, because instead of taking 20 pills to get that dose, you only need 2.
Right. Because I was thinking about that when I was reading over some of the herbal remedies that you talked about, for like arnica for physical pain and injuries, and
Gravelolins. Yeah, those are homeopathics actually. So they're not herbal.
Okay, sorry. But I Googled them. And I was Googling them. I'm like, okay. So, and then one thing you also mentioned was the Rustox.
The Rustox, yep. Those are all homeopathic remedies. Yes.
And all of them said in high doses they're poisonous. So I was like, okay, that could be scary. So I can understand, you know, it would be very difficult without going to a naturopathic doctor to take these sorts of things without knowing exactly what you're taking.
Yep. I'd like to add one clarification. So the 3 that you just mentioned, the Arnica montana, the Rustox, and the rutagraveolins, those, yes, come in herbs, but I do not prescribe them in high dose herbal formulas because they are poisonous.
Because they are.
I prescribe them in homeopathic form. So I wonder if there needs to be an explanation about what is homeopathy.
That would be a good idea.
Yeah. Okay. So homeopathy is a separate system of medicine, which we might use to look at your overall symptoms. And it's based on the principle like cures like. So Dr. Samuel Hahnemann, way back in the 1800s in Germany, he realized that if I give somebody a really low dose of this poisonous arnica flower, when they are experiencing physical pain, bleeding, bruising, you know, they just broke their ankle, like some sort of physical trauma, instead of creating those symptoms at a high poisonous dose, if I give the body this little stimulus of a small, minute, super diluted dose, it actually triggers the body to heal because we're matching a remedy with their energetic symptom picture. And so it's not just, that's a bit of a, you know, counterintuitive or challenging concept to understand with homeopathy, but pretty much we're giving very small dilute substances in their energetic form because it's working on your body at the vital force or your chi, like your energetic level. So it's not just, it's actually the argument against homeopathy is that if you looked at arnica and you looked for atoms and molecules, there's nothing in there. There's only water, which yes, is correct. There are no more atoms of the original substance because it's been diluted past something known as Avogadro's number. So there's nothing left to detect. However, if you took that arnica and you looked at it from an energetic perspective using something called cell spectroscopy, where you're looking for light spectrums and light waves, it will actually show up as a pattern that something is there. And all the remedies look different. So it's a form of energy medicine, actually.
Wow.
Yeah.
That's really
So,
interesting.
and I love it because it's actually very safe. You know, we use it for babies, older adults, people who are on many medications and are scared of interactions. We don't want to make them feel worse.
Right.
Even animals, respond very well to homeopathy. It's very gentle but effective.
I mean, that's a really interesting way and very important to make very clear is the distinction, and why going to a homeopathic doctor or a naturopathic doctor is super important if you're going to start, if you're going to use supplements and all this sort of thing, because it is very scary out there. And again, Google, like I looked up those 3, and the first thing it says, like, or sorry, it was like the third line, it's like, these can be very poisonous, because one of them is a derivative of the rust tox is a derivative of poison
ivy or poison oak. Yes.
Yeah. So I mean, we all know we are supposed to avoid that desperately. And again, with so much in the media right now about certain American topics, you know, like it's very difficult to not be afraid of these things. So going to practitioners and trained people like you is super, super important before doing any of these things, before trying these things. So I just want to point that out.
For sure. Yeah, it's part
important.
of, you know, I feel like every single day I have the conversation, just because it's natural doesn't mean it's safe. Just because, you know, you bought it at the health food store doesn't mean it's safe. Always read the interactions.
And it's good to know that you, as a naturopathic doctor, you've had pharmacology training, because one of the things I was reading is, I think it was the arnica that can react to other medications because it is a blood thinner. That's what I read correctly.
Yeah, but that's only if you're actually using it in a herbal form, not the homeopathic form.
As a herbal form.
Yeah,
but again, see, these are so many distinctions that the average person wouldn't know. So it's really, really important to talk to Dr. Ellen.
Thank you.
Absolutely.
And while you're talking about the blood thinner thing, I know I sent you a couple other options like high dose turmeric or omega-3 fatty acids like fish oil. Everyone's talking about fish oil. Those are actually the 2 main cautions with those 2 natural substances. They both thin your blood mildly. And so that might be beneficial, but what if you're on a blood thinner? What if you're on aspirin? What if you have low iron and you already bruise really easily or have a health condition that leads to that? So yes, they can be beneficial for lowering inflammation and helping with pain management, and they would be safe with the majority of pharmaceuticals. But then with some of them, they would not be good. Or what if you had a surgery coming up? You don't want to start taking turmeric the week of your surgery. That's why the surgeon will always say, just stop everything just in case, because you want to minimize, you know, excessive bleeding if it's not needed.
Right. So always ask a professional.
Always tell your doctor what you're taking. So that's a big educational piece too. I always say, please tell me if any of your medications change. Please tell me if you have a surgery that's coming. And then if I change the plan, I say, let your pharmacist know, let your doctor know. Or let's say I don't see you for a year because you feel amazing. That would be great. But then what if now you're pregnant or your health changes or you're in the hospital because you had a car accident? They need to know, what are you taking?
So even natural things need to be listed in any kind of medication list from any doctor. Even the dentist always asks, have you changed your medication?
It's true.
Yeah. So, okay. So that is our warning, is make sure, that's our message, is make sure that you check with a naturopathic doctor, and also make sure you tell the entire doctor spectrum of what you're taking, whether it's natural or not.
Yes.
Yeah, it's your healthcare team, right? So your healthcare team needs to know what's going on overall.
Yeah. And I sometimes I forget, like, I don't generally take a lot of vitamins or supplements. I've never really found the need. I probably should, but it's never been part of my
an appointment. No,
it's never really been part of my thing. I've always just gone to the doctor because, to be honest, I've never really thought about naturopathy or homeopathy until I started working in this field more and paying attention to these things and realizing that there's a lot more out there. But yeah, so it's very interesting to me, but I've never had an issue.
Yep,
so
that's great.
It's good to know there's other options. So other options then, if you are looking for help with pain management, because a lot of the times the reason why you're in pain and chronic pain could very well be a medical condition. And, you know, I know a lot of people that are just tired of going, they just don't want to do the doctor, like the hospitals and all that. So what options are there? What sort of things? We've already touched on a few, but what can we do that's not pharmaceuticals?
For sure. So there's many different options. I feel like I'll start with an example. So let's say all three of us have migraine headaches. So, oh no, I can't function. My head's in pain, but I need to push through. I need to work. So all three of us can take a pain medication to alleviate our headaches. However, if you see a naturopathic doctor, I really want to explore why. Why do you have a headache in the first place? Which factors in your life or that you're doing or what are you eating that are leading up to the expression of this headache symptom? So just in as example, maybe I only get my headaches every month with my cycle. So I would get a hormone balancing plan. But maybe Tanys, you know, maybe you're really stressed and you have neck pain and neck tension and a magnesium deficiency. And so you would need a musculoskeletal type of plan. And then Heidi, maybe you notice, I always get a headache after I drink alcohol or after I eat Doritos or after the Halloween candy.
I don't do any of that.
And so don't worry, I do all of that too. I have little kids. So I do live a real life as well. So Heidi might get, you know, let's improve your nutrition and reduce pro-inflammatory foods from her diet, or chemicals in her diet that are increasing inflammation in her nervous system. So you can see right there, we all have a headache and a migraine, but the underlying cause is very different for all of us. So that's sort of the first thing I wanted to say to like lay the foundation is you need to figure out what are the factors involved in how you're feeling? What are the underlying causes? And so I guess some of the examples that I shared with you, regardless of underlying cause, they're a little bit more specific for just inflammation. So it's like, if you have inflammation in your gut, you might have gut pain. If you have inflammation in your nervous system, you might get a headache pain. Inflammation in your joints, you have arthritis and joint pain. And so regardless of like all the causes, there's certain natural things that will lower those inflammatory chemical pathways. So turmeric is probably the biggest one that's very anti-inflammatory. It also supports your immune system. And your immune system is what regulates your inflammation pathways.
It's like a circle.
It is a holistic circle.
So weird.
Yes. So turmeric's a great one. We can, you know, add more to our diet for some extra support. You know, people want to just do a daily dose, or there are actually really high dose turmeric supplements where they've bound them to like a fatty molecule for increased bioavailability or increased absorption. So that would be the case of maybe someone with complex pain syndrome, fibromyalgia, arthritis, rheumatoid arthritis, like any sort of autoimmune pain condition. I might say, well, you know, you can eat as much turmeric as you want, but if you take this pill, you'll get 20 times the amount that you could even consume. So a higher therapeutic dose might be effective. And then another one for mitigating that pain inflammatory pathway would be the omega-3 fatty acids. There was a study once that taking omega-3s was just as effective as Celebrex. And so Celebrex is an arthritis pain medication. And so, and these, what's great about these is you can be on your pain medication, but what if it's not enough? What if you don't want to increase the dose or add a second medication or a third medication. These might be more natural options that you can add before you increase your medication load or the risk of other side effects and interactions.
Okay.
So it's not like you take one or the other, like you can, but you can
But they
definitely
can
do
work
a lot of
together.
these together. Yes, and they work together.
I remember when the omega-3 fatty acids, that was big, what, in the late 90s, I think it was. It was like
Yep.
everything had omega-3s in it. And I remember seeing commercials with
Yeah.
now with omega-3s, and they talk about eggs and they talk about salmon and all these things and all these ways of getting these things that we need.
Yep, it's definitely one that's very deficient in the average North American diet. So yes, fortifying it in food to prevent a deficiency, just like how they add vitamin D to certain foods to prevent a deficiency, or they add iodine to table salt to prevent a deficiency.
Right.
That can really be helpful, like a gross population level, for ensuring everybody has like just enough. But there's lots of research that higher doses help with pain, help with heart health, lower cholesterol or balance cholesterol. And it's actually a really big one for mental health because your whole nervous system, all your nerves are coated in not an omega-3, but like in a fatty sort of lipid layer. And so omega-3s really help with, depression, anxiety. They're a great addition if someone's like on an antidepressant and then they're still depressed.
Wow. That's amazing that all these things that, are in our food and are available that can help. And I noticed you also have a nutritionist as well. So that probably ties in very well together with that is not only letting people know that this is what you can do, but here's somebody who can help you actually get it into your diet and learn how to eat and find these things, which is probably getting hard because we're such a processed food. And a lot of these things, a lot of companies don't add these things anymore, or they're actually processing them out if they are there. So it's really, really hard. And I think one of the other problems or hills that you have to climb is the cost of things. And that's difficult because a lot of these more natural products are more expensive. And then you kind of have to figure out, how do I want to do this?
Yes. Yep. So you definitely have to budget and decide, what are your personal priorities or health goals, or what's more in alignment, like with your philosophy for health, and then where are you going to invest your money and spend your time? Like, are you going to cook farm fresh meals every day, or do you just need to go to Tim Hortons that one time? That's okay. It's just, it's like what I always say when you come in, I'm like, oh, let's talk about your daily diet. And then now let's do one step better. So if you are not making any foods at home, I'd be happy if you, got some frozen vegetables and cook those twice a week. That would be better than no vegetables.
Right.
But if you're already coming in on like a pretty clean diet, okay, well, maybe we can go sugar-free. Are you ready for that? Or cut out the alcohol for a period of time. So we definitely work with your baseline. And the goal is just one step better. No one's going to have a perfect diet. It's not realistic.
Well, and it's you have to change everything sometimes. Sometimes one thing is required, but you kind of have to change how you think about everything. And that's why a lot of fad diets don't work. Because the minute they stop doing the diet, you're going to go back to the way you normally eat. You need to change your thinking.
Yep. So definitely focusing on, what are the priority things that would benefit you and your health conditions the most. You don't have to go on a whole anti-inflammatory diet. Maybe we can just, so for example, the nightshade family of vegetables. So tomato, peppers, potato, eggplant, there's actually correlation that those increase joint pain. So if you do have and migraines, so if you're like, oh, I have joint pain, arthritis, or rheumatoid arthritis and migraines, maybe, and I've been eating tomatoes every day, maybe you just need to remove the tomatoes. Sometimes it's a simple fix. It's just like that one food, and then you can just keep the rest of your diet the same. Or the other thing I focus on sometimes is we're not going to take anything out of your diet. We're going to add in therapeutic foods. So one of my favorite ones is Brazil nuts. Have you ever heard of a Brazil nut?
Yeah.
So you only need 2 Brazil nuts every day to get a super high dose of selenium. And then your body needs selenium to make something called glutathione. And glutathione is a very strong antioxidant. So it helps heal inflammation. It protects your cells from damage due to chemicals.
Wow.
And it helps prevent cancer. So glutathione, your body knows how to make it. We just want more selenium to support your body's ability to make it on a consistent basis to protect you from like all the environmental factors.
Wow. Okay, so
Well, I know
talking
what
to
I'm going
you,
out to get.
right? No, but
Don't take 20. You can overdose on selenium.
Good point.
Okay. Good to know.
Good to know.
2 to 3 per day.
It's funny. I have a friend who has chronic pain, fibromyalgia. She has a lot of other things, and she is debilitating at times, and she goes in waves. I'm like, and she hates going to the doctors. So I'm like, maybe I should introduce her to you.
Yeah, sure.
There might be something more, because she loves baking, and she loves she makes a lot of things on her own and everything like that. And I think that would be a benefit for. I'm going to tell her about you.
Okay, I offer a free meet and greet consult. So that's a great introduction. You can learn more about naturopathic medicine and what I have to offer. And then you can discuss, why do you want to come in? Like, do you really want to commit to a big appointment? Or maybe, I can just like, am I the right fit or not? So you get an idea of like what to expect.
And naturopathic doctors you're part of insurance plans, right? Or some insurance plans? Because I noticed you have direct billing on your website, which is always a good.
Yeah, a bonus for sure.
Yeah,
so we do direct billing. So we are not covered under OHIP. So you do have to pay out of pocket.
Right.
We're considered private healthcare. But the majority, like every single health insurance company offers naturopathic medicine coverage. The issue is, has your employer chosen it to be part of your package?
Right. You have to look into it to see.
Yeah. So living in Ottawa, like the Canada Life Plan with all the federal workers definitely covers it. Sun Life usually covers it. Manulife, Green Shield, Blue Cross, those are common ones that people have. So if your employer has it as part of their plan, you can get coverage. It's usually like 80 to 100% covered, up to a maximum dollar amount per year.
Yeah.
And so if you didn't have any coverage at all, one thing I wanted to point out is our regulations say we are not allowed to advertise a discount or a special promotion. But if you are like, okay, well, I don't have a job, but I want to invest my money in this, ask your naturopathic doctor if they can make an accommodation. Because I can definitely do a shorter appointment. You don't have to do a big 1.5 hour initial if you just have one problem. So we could just do a quick 30-minute consult to at least get you started, or a reduced rate if needed. Let's say you're a student.
I see.
And so we have the ability to do a sliding scale or flexible fee structure. It's just we're not allowed to advertise it. So
why would you be able to?
I don't know. So that's a barrier, I guess, like to seeking naturopathic care, but it's one that we can work on. And in Toronto, like if anyone listening is in Toronto, the naturopathic school has, I think, 4 or 5 community satellite clinics where the interns are working. So for example, I did shifts at the Sherborne Health Clinic, so all the patients had HIV or were living with AIDS. So we do community outreach as well. And then, or you could see a student intern at the college for a reduced rate. So you're helping them learn and also getting the care that you might need.
Oh, that's good to know. I mean, I think it's important to highlight these things, and because cost and not knowing what is covered is super, it is debilitating for people. They're like, well, I can't do it. It's not covered. I can't do it. There's nothing I can do. So no, it's important to know that, still talk to them, talk to the naturopathic doctor and see what they can do. It doesn't hurt to ask. You could almost hurt yourself if you're not.
If you don't ask. Yeah. I feel like anything is possible. You just have to ask.
That's right. Yeah. That's right. Okay, so you also mentioned acupuncture. Now, every time I see acupuncture, I think of porcupines.
Okay.
Just because I've never had it done. My husband had a knee injury and he had needling. And I don't know if that's similar as acupuncture or another term for it. But he was like, yeah, they were literally putting little things in my knee and it was very off-putting at first, but it worked. So what is acupuncture and how does it help?
Sure. So there are different forms of acupuncture. So most of the time, I practice traditional Chinese medicine acupuncture, which is based on the philosophy or the principles that there's qi or energy that flows throughout your body that affects different organs and therefore affects their functioning. So the approach of Chinese medicine is, okay, you have these 10 symptoms and they seem very unrelated, but altogether they fall into a very nice pattern of imbalance. So I'll give you an example of liver qi stagnation. So you're like, what is a liver qi that's stagnated? So if your qi or your energy is getting stuck and building up in the liver, the symptoms associated with it are migraine headaches, pain syndromes in the body, growths or polyps, or what's the other word for that? Yeah, like abscesses, like things that grow, you know, or different growths. And then also the mood associated with that is intense irritability and frustration. So your emotions are also pent up. So it could be, I have pain, I'm frustrated and irritable because of it. Or maybe you were very frustrated and irritable and not expressing your emotions, not allowing the qi to flow. And now your body is physically manifesting like something that's showing, oh, your energy is stuck. And so we use acupuncture as a tool along the meridians or the channels. So there's a liver channel that supports the liver energy and the movement of it. So we would put needles into various points to stimulate a certain action. So for pain, if it's stagnation of your qi that's stuck, we want to move the qi and disperse the qi and help it to flow better. So we can do that specifically around certain joints. So like your husband's knee, it's like all the qi is stuck around the knee. So let's do all the knee points to move it. Or we can do a more holistically, like a full body session. So that's what I tend to do. But there's also like dry needling, which sounds like what your husband had, or
I think so. That sounds right.
Yeah, or they call it sort of like sports medicine acupuncture.
It was from a marathon, so that makes sense.
Yeah, so like more physical focused. So in that regard, like the knee, let's say, the knee joint has different muscles that cross and like attach to it and keep it together. So what if this muscle's too tight because you're running and this muscle's too relaxed? So by putting points into the muscles, it helps with rebalancing them or relaxing them to help them function better. And where you put the point in, it also stimulates a lot of endorphin release and blood flow to that joint. So there's lots of research that's like the physical way that acupuncture would help, in that we're getting more blood flow, more nutrients, we're relaxing the muscles, and that therefore helps with pain because you're releasing endorphins, like the natural pain-killing substances.
That's fascinating. That's fascinating that needles in the body could do all of that.
Yep. And then there's even, oh, sorry. Yes, go ahead.
I also want to mention too that like there's, just because you're afraid of needles or the pain of needles, like we would get with a traditional injection, it's not like that at all.
Oh yeah, they're very fine. They're almost as thin as your hair. Often I use silicone coated ones, so they go in more smoothly. If you are getting very joint focused or medical acupuncture, it might be a bit more painful if they're going into your tight trigger points to release those trigger points. But usually a Chinese medicine approach is a bit more holistic and relaxed. Unless you add in the bonus of electroacupuncture.
Yeah, what's that?
So that is let's say there's your knee joint, and we want to get the energy or the action of the needles deeper into the joint, or to affect the nerves if there's like nerve pain or nerve damage. So you stick needles in, and then you put electrodes on, and you send an electrical current through the joint or through the area that you are treating. So obviously, if you have a metal knee or hip replacement, we would not do this.
Don't want to do that.
Some cautions. But electroacupuncture can also help with like nerve regrowth, relaxing muscles, getting more blood flow into the joint space for arthritis, for rebuilding the cartilage. So it's just a kind of a stronger, more intense approach.
Right.
I know I've had acupuncture with Ellen, and that was my first experience with it. And I remember going in the first time, I'm like, you're going to do acupuncture? Wait a minute, what?
Surprise.
She's like, it's okay. And I'm like, okay.
But
I trusted Ellen, so I did it, right? And I was
Mhm.
really pleased that I had, because it did make such a huge difference in my care. And it wasn't, and I don't like needles. So for me, that's why I brought that forward, because it's not the same.
Yep.
Like, it doesn't feel the same.
Mhm.
It's not at all the same.
Yep. It can definitely be scary the first time. And then obviously I walk you through it. I let you know where I'm going, what I'm doing, what to expect. We can stop at any time, I always say, or take a breath or pause in between the points. But then it's funny, acupuncture actually calms and relaxes your nervous system because it shifts you into that calm, rest and digest parasympathetic state. And that's when healing and muscle tissue and repair actually occurs the most. It doesn't occur when you're stressed and not sleeping and going all the time. So people who are like, they're nervous coming in and then they leave and they're like, oh, this is the calmest I felt in forever. So it's shifting your body into a state of relaxation so that healing can actually start occurring.
Wow. So do you learn like pressure points and things like that as well?
Yes, you can do acupressure, which would be great for kids. Oh,
okay.
And we have a comment here about acupressure.
Oh, yes. Okay. So I find
myself.
Oh, do you want to read it? Yeah.
Yeah, I find self-administered acupressure fascinating. Our hands can do so much. Lovely chat. Thanks, Shane.
Yeah, thanks for sharing. So definitely, yes, we can teach you acupressure points for you to do at home, which can be helpful for different purposes. Maybe I'll mention like a very common one, because if you Google it, this can definitely show up. So there's one called large intestine 4. So it's on the large intestine channel, and it's the big one on your wrist here. So there's this crease between your thumb and your first finger. You just follow the line up to this meaty pad, and you just dig in there. So you can sort of dig in and massage in a circular motion. Sometimes it's tender in people, and you just take some deep breaths and massage for 30 seconds to a minute. You can also do it on the other side. But then heads up, this point is contraindicated if you are pregnant. So if there's any pregnant listeners, we would not want to do this, because remember, we want to move your chi. So we don't want to move your baby before your baby is due.
Yes.
Right.
And then the other heads up with this point is it's on the large intestine channel. So what else do you think it moves?
So I'll need
you
to
might
go to
be
the
running to
bathroom,
the
is what you're
washroom.
saying?
Yes, it moves your bowels.
Yes.
So if you're
constipated,
that's something you do. If you're constipated and feeling pain from that, you could just do that pressure point as well.
Yes, it would be supportive of moving the large intestine stuck energy.
I don't have that problem, so I'm going to stop.
Okay. Sounds good. Heidi will be running to the bathroom.
Right? And I'm like, oh, gotta go.
We only have a few minutes left, but
Yeah. That's funny. So what other things, like how do we know, except for going to a naturopathic doctor, how do we know what we could do? Like you were talking about glutamine powder.
Oh, yes.
It's funny. I'm looking at a lot of these words and I'm thinking, I just took my dog to the vet and he's getting old. And the vet actually mentioned quite a few of these things for him as well.
Okay. Yeah, so maybe I'll talk about a couple more things. So the glutamine powder, glutamine is an amino acid. So it's a component of protein. It's just that one amino acid at a higher therapeutic dose. So glutamine is actually very great for healing the lining of your intestines. And did you know, I think it's about 70 to 80% of your immune system is located in the lining of your intestines. So often, so as if you see a naturopath, we're always going to talk about your gut health and your digestive function. And so if you have anything autoimmune going on, immune deficiency, chronic pain or inflammation, and you have IBS, so you're like, oh, like I always have gut pain, I'm always bloated, nausea, heartburn, alternating constipation, and diarrhea, there very well might be a connection between your gut health and your inflammation, because your immune system in your gut is affected. So
Okay.
glutamine's a great one for repairing the immune function and the lining of your gut, and therefore helping your immune function better elsewhere and deal with inflammation.
Wow.
And then I just want to clarify that is different than glucosamine, which maybe
Right.
your dog was prescribed for
Yeah.
arthritis.
Yeah.
So, so glucosamine is also another substance that can be used. And that one is something that we need more of to repair our joints and our cartilage. So as we get older, we lose that squishy cushion cartilage in our knee joints or our shoulder joints, and then the bones rubbing on the bone, and that's what arthritis is, or osteoarthritis is.
Okay. Is that what I need every time I climb up the stairs?
Possibly, yes. And so, so if we add more glucosamine to the diet, so you can eat more if you like having bone broth or soups and stews, because you're boiling the bones and the joints of your chicken and your beef. And therefore, you're pulling out the calcium and the glucosamine and the chondroitin, all the nutrients, the collagen that support the animal's joints. Now you are consuming more. So that would be a food source for eating or ingesting it.
Okay.
And then just another caution with a lot of glucosamine supplements, because it's found in cartilage, they're sourced from shellfish. So that's a key thing. Always read the label, because what if you have a shellfish allergy? Then you do not want to take glucosamine because it's from a shellfish. So there's a risk of an allergy. Just another example of just because it's natural doesn't mean it's safe.
For you, for one person.
Yeah, exactly.
So
that is kind of scary to think about allergies and things that people are allergic to. I have a friend who's allergic to shellfish.
Okay.
So, and
do not take glucosamine.
No,
they might. There's a newer one out there called NEM, which is eggshell membrane. So it's just a different source. But it also really helps with joint repair and arthritis. So I guess to answer your question before, like, how do you know what to take? It really depends on what's the underlying cause. So do you have a nutrient deficiency? Do you have immune system regulation issues? Are you eating a lot of inflammatory foods? Are you really stressed and not sleeping well, so your body just can't repair itself because you're on high adrenaline fight or flight all the time? Or maybe you have all of those and need some sort of combination.
And a vacation, really, it sounds like.
Yeah. So really, I think the message would be like, listen to your body and think about what are the factors that led me to have these symptoms, because that might give you a clue. Because that's what I do all the time. Like, let me ask you all these questions and figure out what led you to this state. And then we sort of address those underlying causes. Yeah. And so I can't say choose one over the other. It really depends.
And so for this particular question from Shem, I would say that probably she should be speaking to, like having an appointment or a discussion with a naturopath, as opposed to just, right?
Yeah.
Because
so
there could be other reasons. She's meaning the lining of.
Yeah, the lining. So the endometrial lining is the lining of your uterus. And yes, for some women, it can get thicker. So I feel like it's another whole topic, but I would look at your hormone balance. Often it's higher estrogens that can lead to endometrial lining thickening, or the growth of fibroids, or endometriosis, or cysts on the ovaries. So maybe you can invite me back to do a whole hormone talk. But definitely, I would look at your estrogen balance and also explore the concept of xenoestrogens. So those are chemicals in the environment that act like estrogen in the body in a negative way. So they actually increase the estrogenic response. And then the most common one is the BPA in plastic. So it's a known hormone disruptor. And that's why it binds to your estrogen receptors and creates this large negative estrogen response. So that's why they're saying minimize your plastic, use glass, don't microwave your plastic.
I remember everything was BPA free for a long time.
Everything was BPA free. So that's one chemical we've identified has a big hormone disrupting action. So you can minimize your exposure as much as possible. And then the other thing I'd suggest is look at anything artificially fragranced. So a lot of the artificial fragrances and cleaning products, body products, things like that, they are also hormone disruptors. But the great thing about those is your body can clear them out in 48 hours. So once you say, oh, I'm not going to use my smelly laundry detergent anymore, or my body spray, or all the stuff I use in the shower, then it's very easy to detoxify and clear those things out.
Awesome.
If you want a website, Shamiana, there's a website called the Environmental Working Group. And so you can go to their website and punch in all of your body products, all of your cleaning products. They even have an app. It's like the EWG verified app, I think, to see if what you have in your household could be contributing to hormone disruption. Mm-hmm.
And hormone disruption can cause cysts on the ovaries, you're saying?
Yeah, if you have chronically high estrogen promotes growth of the endometrial lining, or abnormal growth. Or fibroids. It's linked to all of that. It's linked to breast cancer.
I'm going to be saving that information for some people that I know.
Okay. Yeah.
Awesome.
It's
I should save that website. Yeah, for sure.
Yeah,
for sure.
You can't live in a bubble and avoid everything. So it's just, what are you applying to your body that maybe you don't need? Mm-hmm.
So what's the website again?
Oh yeah, it's the Environmental Working Group. I think it's just ewg.org. I can double check really quick. Yeah, I can check quick and put it in the chat if you want.
Yeah, that'd be great.
It's ewg.org. And then they have like a skin deep cosmetics database where you can put stuff in. It looks like I have to connect my YouTube account to join to the live chat. So maybe I'll just say it again, or if one of you guys.
If you want to put it in the whatever information you'd like in the private chat in the side there for us, I can put it into the chat for everybody.
Okay, here. Yes, so ewg.org. Oh, and then it's interesting. Shem says that they also have fatty liver. And so your liver is the big organ of detoxifying all of these chemicals. So like I said, we can't live in a bubble and avoid everything. So part 1 is minimize your exposure. Part 2 is support your organs of detoxification. So how is your liver? How's your skin? Are you sweating? Are you drinking water and urinating? And are you pooping every day? If you're not pooping every day, all those chemicals are just being recycled every day.
Oh, wow. Okay, so quick question though, because this is all very, very interesting, but we are a senior focused company. So how can some of this information, I mean, a lot of our clients have already gone through menopause or are, at the end of it. So does that change anything for seniors that are having issues?
It's actually more important in seniors because when you are in menopause, your natural estrogen has gone down. So now all your estrogen receptors are all open and available, waiting for something to bind. So these hormone disruptors are actually what contribute to the increased risk of breast cancer once you're in menopause. So it's even more important for senior women to minimize their exposure, make sure they're detoxifying to balance like the effects of all these hormone disruptor chemicals in our environment.
Oh, I'm going to send this to my mom then. She's in the midst of it. And she's very much prefer the natural course of things versus medication. She's very earthy now.
I can share maybe one more example. It's more of like a young woman, like a teenage example. This girl came to me and she was just like, my periods are crazy. I'm cramping, migraines, heavy, breast tenderness. I can't function. But I don't want to go on the birth control pill. I want to treat it naturally. So I asked some questions and I found out she's burning her scented candle in her bedroom all evening and then sleeping in it. I'm like, hey, so you're having 12 hours of constant exposure to an artificially fragranced candle. So I was like, just remove that and stop using it. And then all her period symptoms went away. So sometimes it's a really easy fix. It's like this thing in your environment that you're exposed to low dose is really affecting your hormones.
That's insane.
Yeah.
And if you think about all of them added together, that's why it's very important to support your detox pathways.
Wow. Man, now I'm looking back at all the things that I've done in my life because this is not senior focused at all, but perimenopause, I started in my late 30s and I went through like 2 years of pain all the time, not even just during the cycle, all the time, and PMS and everything like that. And, you know, I think back to probably a lot of the environmental factors that I had going on in my house that I probably shouldn't have done.
Okay, well, they could have contributed. It's hard to say, but definitely in perimenopause, this can be aggravated because your progesterone goes down first before your estrogen goes down. So if you have lower progesterone, you already have estrogen dominance, and then that difference is even greater. So estrogen dominance leads to all of those PMS symptoms.
Wow.
Yeah.
Oh, that's crazy.
Yes, you can still make a change today. It's still, you know, like I said, they come out of, your body detoxifies them in like 2 days.
That's crazy. Okay. So, so this ewg.org sounds like a really good website that you can, it's just as a person Googling things on the internet, at least they can start looking there and see what kind of factors you can do to see, and that might help with pain management and everything. And because I know a lot of people with the chronic pain, the first thing they start doing is cutting things out, like sugar, like alcohol, caffeine.
Those are foods that create inflammation. These are just chemicals that contribute to inflammation in your environment. So yes, you definitely want to consider them for pain management.
The environment, not just what you eat, not what you ingest. You got to think about what you're breathing, what you're putting on your skin. Wow.
Yeah, our body is a full system, right? So we've got to look at all aspects of it.
It's crazy.
It's awesome. Well, we are almost at our hour.
Yeah.
So what have you got? Now, I know you do classes and all that sort of stuff as well at your clinic often. I'm just wondering, do you have any of those up that you'd like to share?
We actually do not have any workshops on the go at the moment.
Okay.
Are in the phases of planning stuff for January. So check back then.
Yeah.
So right now I would just invite you, if you're interested in learning more about naturopathic medicine, to book a free meet and greet with myself or one of the other naturopathic doctors. And then we'd be happy to answer like your individual specific questions.
Yeah, you have a great team there. So
yes, thank you.
Yeah.
So the meet and greet, can you do it virtually or over the phone?
Yep, it's virtual. We send you a link to a video chat, or it can be over the phone.
Okay.
Yeah, it's just 15 minutes.
Oh, perfect. And just kind of gets an idea if what you can do is something that they're interested in, or
like would it be beneficial for you? Or sometimes people come and I'm like, oh, actually, I think you have Lyme disease. So then I'll refer you to another naturopathic doctor. So it's a great screener as well. Or sometimes, I just give general tips or just refer them to maybe a person that would be a better fit, or they decide that naturopathic medicine with myself is the right fit for them.
Excellent. That's amazing.
Awesome.
So any little 2-minute tip that you can provide for general pain? Is there something that we can do when you're just feeling blah?
Okay. Yes. When you're just feeling blah, I would say listen to your body is the biggest thing. So your body is communicating messages to you. So when do you feel the pain? When is it at its worst? What is it forcing you to do? Maybe it's forcing you to rest and take a break or get an extra hour of sleep. Maybe that's actually what you need. So I would say that would be my biggest tip is listen to your body. What is it trying to tell you?
Because your body's a pretty amazing thing.
And drink water, right?
Yes, excellent. And drink water.
Is soda water okay?
Yeah, it's okay. I would be a bit cautious if you had like osteoporosis. Sometimes the bubbly acid it's like having pop, like the phosphoric acid in pop leaches your calcium. So, yes.
Oh dear.
So it's definitely better than no water.
Yes. Generally what I drink. Because I don't like water is not makes me feel sloshy and heavy, but soda water seems to work better. But good to know, but I don't think I have osteoporosis or anything yet. So good to know.
Keep in mind. Things to remember, right? little bits of information.
Mhm.
Well, it has been, you're a fountain of knowledge.
Oh, well, thank
So
you. I
much
love
knowledge.
sharing it. I could talk about this all day. So.
It's, yeah, I mean, and I've, as I've been one of your patients or clients, it's always been amazing. So thank you so much for joining us here and
you're welcome.
sharing all of
me.
that. And I'm sure we'll have you back again,
Mhm.
talk about different topics as the years go through.
Mhm.
So thank you all. And don't forget to come back and join us for Compassionate Chats. And also like and subscribe, please, so that you know when we're coming back on. All right. Thank you all. And we'll see you next time.
Okay,
Thank
bye.
you.